Hello, I am Dr. Thomas Chapman. I am an internal medicine specialist at Clay Platt Family Medicine. I see and treat ages 14 to whatever as an adult specialist. One of my interests lies in allergies, asthma, and COPD, chronic obstructive pulmonary disease. I do treat the full array of adult and adolescent medical disorders, but I've always had an interest in allergies and asthma. I am a lifelong allergy sufferer. I do not have asthma, but I do have exercise-induced bronchospasm, which is a disorder characterized by wheezing and or shortness of breath or cough that can be associated with strenuous physical activities or cardiovascular activities such as running, cycling, and swimming. Well, we are at that time of the year. Labor Day is typically the hallmark weekend of ragweed allergy, typically called hay fever. This is allergy typically to ragweed. Ragweed starts growing in the month of August. It does not just appear or sprout up the week before Labor Day. It actually does like warm, hot, dry months like the summer that we have had. So as we talk, ragweed is standing up tall and proud, and the ragweed counts are astronomical. We have also had an unusual summer in the fact that we've had high temperatures early on, and typically the higher humidity, we've had high pollen counts and high mold counts. For the month of August, we've had red alert days with ozone and the high ragweed and grass and mold counts. If you notice on the news many times, you'll see the red alert days. They will typically warn patients, especially that have asthma or COPD. Again, COPD stands for chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is an array of emphysema, chronic bronchitis, and asthma, and they all three typically overlap in the COPD patient. Because of our bad atmospheric condition days, again, they'll warn that if you have asthma or emphysema, to avoid outdoor contact, gassing up the cars later in the evening, also potentially wearing dust masks to protect yourself when you're outdoors, period. At this point, you can always see a doctor for your allergy care. There are several products over the counter that used to be prescription medications that are now over the counter and are the same strength type medications as we used to write prescriptions for. You can find Allegra 180 milligram or Claritin 10 milligram or Zyrtec 10 milligram, all in the generic type products at Walmart, Walgreens, or CVS. Typically find the name brand product and you will find the generic product next to them. If the over-the-counter products are not working, it may be time to go in and see your physician. We do have a wide armamentarium of prescription type medications if the over-the-counter powerful antihistamines that I've previously talked about are not working. If you are having worsening asthma symptoms or worsening emphysema symptoms, especially this time of the year, it is probably time to get in and see your physician. Again, we have powerful medications that we can use to treat COPD, asthma, and allergies if over-the-counter products are not working. With asthma and COPD, you want to have a well-established baseline with your physician. These are serious diseases, and we still have a large number of deaths annually from COPD, asthma, and emphysema. Again, we do have powerful medications, and your doctor will typically work up an action plan for you to cooperate with and entertain in your health care with your physician. Watch stop for a second.
Okay.